Hello and welcome to this Coaching Veterans presentation on scars and disfigurement, presented by me, Paul Bunn, with Veterans Outreach Ministries. You can reach us at 1-888-833-1942 or visit us online at www.vetcenters.org. Today we're focusing on scars, one of the most common but often overlooked service-connected conditions. Many veterans live with scars that cause pain, limit movement, or impact confidence. We'll discuss how the VA rates scars under 38 CFR Section 4.118 when they can be presumptive under the PACT Act, and how to prepare for your C&P exam. Scars form when the body heals after an injury, burn, or surgery. They may look like a simple mark on the skin, but for many veterans, they cause ongoing pain, itching, tightness, or reduced mobility. Some scars are highly visible, while others are deep or unstable, meaning they reopen or break down over time. Example, my scar from surgery still feels tight and burns whenever I bend or lift. The VA recognizes several types of scars. Linear scars are long and thin, often from surgical incisions. Deep or nonlinear scars are from burns or trauma like blast injuries. Some scars are painful or unstable, meaning they break open or cause nerve irritation. Others involve visible disfigurement, particularly on the face, neck, or hands. Example, my burn scars from deployment are sensitive and sometimes crack open in hot weather. Scars can be directly service-connected if they resulted from an injury, burn, or surgery during service. They can also be secondary to another service-connected condition. For example, a veteran who had back surgery for a service-connected injury may claim the surgical scar as a secondary condition. Example, my scar is from surgery I had in service to repair torn ligaments in my knee, and it still causes pain when I kneel. Under the PACT Act, some scars, especially those from burns or toxic exposure, may now qualify as presumptive if linked to hazardous environments. Veterans who served in areas with burn pits, chemical exposure, or radiation such as Iraq, Afghanistan, Djibouti, or other recognized PACT Act locations may be eligible for presumptive service connection for scars or related skin damage. This means the VA presumes your exposure caused the condition, even if the scarring developed later. Example, my burn scars are from exposure to jet fuel and smoke during deployment, and my doctor confirmed they are covered under the PACT Act. The VA rates scars under 38 CFR Section 4.118, which covers diseases and injuries of the skin. Ratings are based on several factors, including the size, number, and location of scars, whether they're painful or unstable, and if they cause disfigurement or limit function. Example, my facial scars were rated at 30% because they're visible and cause tightness when I move my mouth. Here's how the VA rates scars. A 10% rating is typically assigned for one or two painful or unstable scars. A 30% rating may be given if there are 3 or 4 scars that are unstable or painful, or for disfigurement of the face, neck, or exposed areas. Ratings from 50% to 80% apply for severe disfigurement, tissue loss, or functional limitation. Example, I have several scars on my legs that crack open and hurt whenever I walk or stretch. Scars may also qualify for a separate rating if they cause chronic pain or nerve involvement. For instance, if the area around the scar has reduced sensation or ongoing tenderness, it can be rated independently under the VA's pain regulations. Example, my scar isn't large, but it's extremely sensitive and painful whenever it's touched or rubbed by clothing. Some scars, especially those on visible areas like the face or hands, can lead to emotional distress or social anxiety. The VA recognizes that visible scars can affect mental health and may allow a secondary claim for depression or anxiety. Example, my facial scars make me self-conscious in public, and my counselor linked my depression to my service injury. Scars can also result from surgeries for service-connected conditions. If you had surgery while in service or as part of treatment for a service-connected condition, those scars may be eligible for compensation. Example, my chest scar came from heart surgery performed while I was active duty, and the VA recognized it as part of my claim. Scars linked to burns, chemical exposure, or environmental hazards are now more widely covered under the PACT Act. Veterans who work near burn pits, fuel storage, or other toxic sources can develop chronic skin irritation or scarring years later. These scars may qualify as presumptive under 38 CFR Section 3.309 when supported by a doctor's statement or exposure record. Example, my doctor connected my skin scarring to years of exposure to fuel smoke during deployment, and it's now part of my presumptive claim. Before your C&P exam, make sure you identify all scars that cause pain, limit movement, or are visible. Be honest about discomfort, tightness, or itching. The examiner may measure scars, take photos, or test for sensitivity. Example, I told the examiner that my scar becomes sore and cracks open when I move too much, especially during physical activity. Lay and witness statements can help your claim. Spouses, family, or coworkers can describe how scars affect your comfort or mobility. They can also discuss emotional or self-image changes caused by visible scars. Example, my wife wrote that my scars cause me daily discomfort and that I often avoid being in photos because of how they look. Documentation is key. Take photos of your scars in clear lighting, note the date, and include measurements if possible. Keep copies of medical treatment records, surgical notes, or dermatologist reports. Example, I submitted photos showing that my scar tissue often becomes red, painful, and swollen. The VA recognizes scars under 38 CFR Section 4.118, A for veterans exposed to burns, toxins, or chemicals. Even a single painful or unstable scar can qualify for compensation, especially if it limits movement or causes emotional distress. Remember, your scars are a reminder of your service and sacrifice, and they deserve recognition. For more information, visit www.vetcenters.org or call 1-8883-301-942. You've served your country. Now it's our turn to serve you.